A very warm welcome to Birmingham ICC again. For about the fourth year, I think we've been here with COVID in between, so many familiar faces in exhibition and in the auditorium. But I'm seeing lots of new faces with over 1,100 delegates. So this is of huge interest, tech-enabled care to everyone. May I firstly take the opportunity to thank our sponsors, Anthropos, Legrand, Taking Care, Access Assured. They work with us throughout the year and support us to be able to deliver this fantastic event. Let's start with the hard-to-miss headlines about the crisis in health and social care. We're seeing gridlock in the hospitals and social care waiting lists, with workforce and funding shortages, meaning services just can't cope and the demand keeps rising. People whose needs would be better met in the community, in their homes, spending hours waiting for ambulances, or find themselves stuck in hospital, desperate to be discharged and return home. Other individuals who want to stay in their own home or find it really difficult to access social care that will help them do just that, instead facing long delays for assessment and review. I am sure we will all agree this can't go on. We need further, faster, at pace missions to build integrated community care services. And that's where you all come and play a massive, huge part with your imagination, your resourcefulness, and partnership working of our wonderful technology-enabled care sector. This is where you can help. We have the hard evidence that technology-enabled care reduces calls into ambulances of up to 75%. We know that 85% of people who've fallen remain at home if they called their tech responders in the monitoring centres. Tech services reduce that length of stay in hospital by over 5 days on average, and they help 40% of people to access voluntary and community services rather than formal social care. But most importantly, tech helps people to live the lives they want to lead, doing the things that matter to them in the places they call home. So why, oh why, aren't we seeing the widespread adoption of tech services by health, housing and social care systems across the UK? I want that question to be at the forefront of all your minds over the next 2 days as we see those leaders, as we see those people stepping into the unknown and delivering fantastic integration. Our sector is on the cusp of a transformation, but we need to drive appetite for the expansion so we truly can see the potential and realise that potential. This conference is all about making things a reality. And year on year, I see you all develop. I see you all striving forward to truly change the lives of people in our communities. We want to arm everyone with inspiration, learning, ideas, and networks so you can scale your services and support many more people to stay healthy and happier at home. Integration will play a key role over the conversations on plenary and in the innovation stage. But technology-enabled care is about joining the dots across the health and care system, wrapping care and support around individuals. It can be proactive. It can identify and communicate people's needs, connecting them with the things and the people they love and the support they want. And it can thread together services and data, connecting with a host of different health and social care teams to share information and coordinate support. But now we must prove that tech sector's collaborative skills can be used to gel together new integrated models of care woven from a creative ecosystem of relationships and approaches. This is not just across health and social care and housing, but also in neighbourhoods, via informal groups and charities. It's no surprise we are seeing a policy drive in England, Scotland, Wales and Northern Ireland for a single digital front door, giving people easy access to this rich web of information, services and support. And it's no surprise that more care providers, local authorities, NHS Trust and health boards are adopting a home-first approach, exploring ways for people to access the care and support they need in their own home rather than hospital or residential or nursing care. Technology is the common ingredient. In both these approaches, we are, as a sector, we must do more so innovation in health, housing and care isn't stifled. More than ever, we must make the case for technology-enabled care so commissioners invest into large scale. They scale up these service provisions, this magic that's being delivered across the UK, so that high-quality digital services and people can quickly access the right care at the right time in the right place. This journey, we are all on it together, and I, for one, am incredibly proud and excited about the future of technology-enabled care and the opportunities it can and will deliver to unlock personalised outcomes for people in communities, our conference theme. Here on Keynote and in the innovation stage, we'll hear from policymakers and government, the launch of the Tech Action Alliance Challenge Report, provoking debate about common purpose of technology-enabled care, guides to get started in co-production, and day 2, the theme in Tomorrow's World, setting a vision for the future with plenary voices from across the UK and as far as afield as New Zealand. You will find fabulous examples of wonderful implementation across the UK on the innovation stage in the heart of the exhibition. This evening, we're delighted to be joined by over 500 professionals at our prestigious awards gala dinner, ITEC Awards 2023, recognising the exceptional work and creativity of you, our tech sector. Good luck to the fantastic shortlist organisations, and I'm looking forward to seeing you all this evening. But for now, on to the programme for today. We have a slight amendment and change to the programme, but we're now delighted to start our keynote, welcome Michelle Dyson, Director General at the Department of Health and Social Care, who will present our opening presentation. Thank you.
Hello, everyone. I am really thrilled to be here again at your conference. Thank you for inviting me. I think you have a really powerful agenda, as Alison has just described. And the thing that I find really inspiring about this agenda is your recognition that things in adult social care, and indeed across the health service, things are very tough. But there is hope. There is innovation. You look to the power of technology, the power of community, and this sense of all of us pulling together to harness that. So today I'm going to talk about the government's position on this. In December 2021, we published People at the Heart of Care. This is our vision for social care reform. It was co-produced, that is so important, it was co-produced with more than 200 individuals and organisations. And importantly, the new government, because this was obviously issued by a different government, the new government is 100% behind it. And we will shortly publish a plan setting out the progress so far in terms of our implementation. The 10-year vision set out in People at the Heart of Care is something that you will all recognise, that people should have choice, control and support to live independent lives, that people should be able to access outstanding quality and tailored care and support, and that adult social care should be fair and accessible. So today, in my sort of fairly short presentation, I'm just going to pick out some key aspects of the people at the heart of care to highlight and tell you where we have got to. So one of the things that I think is hugely important is the adoption of digital social care records. This sounds, maybe not to this audience, but I talk about it a lot. This sounds like a fairly dull issue, but I think it is so fundamental. I find it amazing how many care homes in particular that I go into where people are still doing beautiful handwritten records. The government has committed to rolling out digital social care records to 80% of CQC registered providers by next year. And as this slide says, we're at about 50% so far. Now, why does this matter? It matters because it will enable our care workers to do the thing that really matters, which is to look after the people that they want to serve. So we reckon that digital social care records save 20 minutes per care worker per shift in terms of not having to do the sort of handwritten bureaucracy that they do with current records. That's a huge saving. And that means that they can be spending that 20 minutes per shift looking after people rather than filling in forms. And it also matters because digital care records can be shared easily with the NHS, thus sort of helping on the integration agenda, which we all recognise as being really, really important. We're also testing lots of different care technologies. We've given money to integrated care systems across the country. They're testing all sorts of different things. It's down to them at local level what they want to test. They're testing things like vital signs monitoring. So does it help if you attach something to an individual so you can read their blood pressure easily? Does that help to keep people in their own homes? Medication management technologies, again, is that something that helps to keep people in their own homes? Falls prevention technologies. As this audience knows, there are so many things that we can test, but it's really important that commissioners see the value of those technologies if they are going to invest in them. Another really, really important aspect of our vision for reform, and one that is probably underrated because it's not the thing that hits the headlines, is good data. Now, data matters so much, certainly in central government, where I come from, data speaks, but data matters at every level of the system, whether it's a local authority, a provider, or whether it's to join up health and care. And it would be fair to say that data in social care has never been as good as other parts of the public sector. So we are launching a new, what we call a client-level data collection, not very clear what that is in terms of its name, but what it is we are going to be asking local authorities to report to us quarterly on every person who comes to them for social care support clearly on a sort of anonymised basis. But this could be absolutely radical, transformative, because we will be able to see all the characteristics of everybody in the social care system, how old they are, where they live, etc. We will also be able, once the data is joined up with health data, we will be able to see the moving between the social care system and the health system and back again. The insights from this are potentially transformative. We've published a document called Care Data Matters. This is for consultation. This has got all of our data plans in it, the client-level data collection by local authorities, which I have just mentioned, but also what we're doing with providers. And I do hope as many people as possible can comment on this, because clearly everyone buying into what we're doing on data really, really matters. Slightly separate from what we're doing specifically on data, we are starting from April this year, and so next month, very soon, in fact, next week, new powers for the Care Quality Commission to assess local authorities. Now, I'm sure you all know that the Care Quality Commission regulates providers, but it doesn't have any role, it doesn't currently have any role in relation to local authorities. It does for children's social care, but not for adult social care. So from next week, albeit this is going to roll out more slowly than actually next week, but the legal powers begin next week, the Care Quality Commission is going to be assessing local government commissioning of or how they are performing their Care Act duties, which again has the potential to be really transformative. I feel I'm overusing that, but I genuinely believe this because it will shine a light on what's going on in local authorities, hopefully in a really positive way that will assist in terms of improvement. So the care workforce obviously is front and centre of our reform plans because everything about social care is about the workforce, the huge 1.5 million workforce. The care workforce is a really professional workforce, but there is no means currently of recognising that. So our workforce reform proposals are all about rectifying that. We're going to be consulting shortly on a new career structure with training. We're going to be providing more training. I'm really struck that, other workforces, I'm part of the civil service, the NHS, there's a really clear career structure, but nothing like that for social care. So that is what we're going to try to provide. And we're going to, we have the base level qualification in the care sector is the care certificate. But because it's not a regulated qualification, every provider does it differently. So you have this crazy situation where someone who has a care certificate moves employer, but the employer doesn't recognise the care certificate that they have, so they're asked to do it all over again. We're going to end that. So there is one care certificate, which will hopefully really improve things. It's worth a mention of the immigration position. So last February, we put care workers onto the immigration visa system. And since then, we've had over 55,000 workers who've come in from overseas to help fill the gaps, which are very well known in the care workforce. So that's been really, really welcome. And the problems with the care workforce reflect the very tough situation at the bottom end of the labour market, and it's been absolutely great to be able to draw on the enthusiasm of people from overseas to come into this country to support the care workforce. And we've continued to run a national recruitment campaign. I hope people have seen it. I certainly have just come across it in the media, national newspapers, etc. Some really moving stuff. Sorry, that's my piece of paper making a noise in the microphone. So, look, I think it's just as I started, I think it's so important that we work collaboratively to achieve our vision. And I wanted to give you an example of something that we discovered almost by accident, which I'm quite excited about. So we were working last year, beginning of this year, on implementing charging reform, which we were going to implement this October, but is now delayed. And we were working with 6 trailblazer local authorities in terms of how to do that. One of the challenges of charging reform was that we were going to have to bring so many more people in for local authority assessments, because all sorts of people who are currently private payers in the social care market who would start to need to have a relationship with their local authorities. And the challenge was, how can local authorities cope with that, given the volume? There are already big waiting lists, as you'll know, in local authorities. How can you cope with that sort of additional demand? And what we discovered through working with local authorities, through care homes, with tech providers and many others, that there was a solution, that there was a way to do assessments differently that was much more effective, much more efficient. So what some of those trailblazer local authorities, they adopted different social worker models, so different mixes of staff doing assessments. Others used care homes to do assessments where people were already living in care homes. And others worked with tech providers to use tech to triage people. And overall, we found sort of 30% productivity gain through that route. We're continuing to work on this. We're continuing to work with all local authorities to roll out the sort of exciting things that we found, almost, as I say, by accident. But I mention this because I think it is an example of how we can work together to achieve our vision. And, I'm from government and I'm setting out what the government wants to do, but everyone has a part to play on this. It's about every part of the system collaborating to achieve the vision that we all agree on. And I hope this conference is going to play a big part in that, and have a really excellent couple of days. Thank you very much.
Big thank you to Michelle Dyson being on site with us today, and collaboration and working with our policy and government officials is something that myself, Paul and David, our chairs, work, and we'll be picking up with Michelle after today. She mentioned some key things in her presentation: power of the community and working together. That's her call to action to us to keep doing our amazing work and showing the art of the possible to our colleagues of how we can spread it into the communities of social care. Innovation and hope. We've all got hope in this room, and we all know this is achievable. Workforce, data, collaboration. It'll be good to pick some of those themes up with Michelle and her team. And there's lots of her team here over the 2 days. So now on to the golden thread. We've just heard from Michelle about co-production, working with people who receive and draw on services. The policy drivers are about putting people at the heart of care. That's our white papers across the whole of the UK. But we do hear loud and clear that that's what we need to do. So everyone has the right to lead their life the way they want to, with meaning and purpose. This means doing things that matter to them. I really had the pleasure of meeting a fantastic individual that really touched my heart. I think it was the latter part of last year. And I thought, I need to get him on that stage to open conference, because I'm sure he will give you all inspiration. He'll give you the insights of why we are here and why we continue as a tech-enabled care sector to make a real difference. Can I welcome to the stage Rich Amos?
Thank you, Alison, for your warm introduction. It is a privilege to be able to sit before you all this morning, and to have been asked to be this year's opening speaker of Day One at this International Technology-Enabled Care Conference. Knowing it is an international event, I was curious to know what corners of the world I would be jetting off to. Allow me to introduce myself. My name is Rich Amos. From seeing me sat in my wheelchair, you may well be thinking the speech is going to be from a service user. I grapple whenever I hear that term, and hope by the end of my speech you'll understand why. As for who I am a son, a brother, a friend, a member of the West Midlands ADAS Regional Co-Production Advisory Network. I'm a socialite, an employer. I'm a lover of life. I'm dependent. I'm a Wolves fan. I've been an England bocce champion. I'm disabled, but I'm a person. We are not a directory of experiences that we can simply shelve and press play to because of the etiquette of the situation we are in. What we are human beings, enriched by the tapestry of our identities, from faith to our economic situation, shaped by the showing of the way when we were kids, any trauma we may have been exposed to, and the beliefs and values we hold. In the context of co-production, we need to take the same approach that allows a person to bring the richness of their multifaceted layers rather than lived experience alone. The trend to recruiting people with lived experience often requires someone to have a direct experience of, say, tech, for example, but in doing so are limiting and possibly devaluating someone's contribution if it is from that viewpoint alone. I may have particular insight of tech, but my contribution will be from my life's worth of experience and identities. That little switch can be so empowering, as after all, the language we use is the biggest power we hold. The theme of this year's conference is unlocking personalised outcomes. But what does that phrase mean to you? Please have a moment to think. Are you living the model in which you believe the term is embedded into your culture? Or are you looking at that phrase, wondering where to begin? The connection between those examples is they each have a starting point in which for every one of us in this auditorium will be different. If we look at the words unlocking personalised outcomes in isolation, we can understand their meaning as described by Cambridge Dictionary. Unlocking, to discover important new facts about something or someone and make them known to people. Personalised, used to describe an object that has someone's name on it or that has been made for a particular person. Outcomes, a result or effect of an action. What strikes you about those definitions? For me, it is the words discover, made for a particular person, and result of action. A clear journey spelt out. When talking about technology-enabled care, I am both cautious and optimistic. Cautious because in a world where money is being squeezed, statutory agencies often behave as though tech is the solution for replacing human support, which I've had suggested to me. But I'm equally optimistic, as when used for the right purposes, tech can be an enabler to reduce our carbon footprint and make processes more efficient. An enabler because tech can better keep those in their homes for longer. But above all, tech is an enabler because it gives opportunities for people to achieve things that so many of us take for granted, giving people choice and control over their lives. In order to look at these sides a little deeper, we must first redefine what we mean by independence. If independence is slowly being used as a belief that it is doing things for yourself, then I would still be in bed right now. But am I less independent? I'll let you decide. Broader speaking, in relation to how the world functions, we rely on choreographed displays of interconnected movements, like the ecosystem, or how a letter reaches the recipient after popping it in the postbox. These are examples of how they couldn't be achieved on their own and are interdependent of the different components to be a success. We need to shift the narrative from thinking about independence to interdependence and recognise it as a strength-based approach of the utilisation of skills and experiences from one another. Because in reality, what can really be achieved alone? In a new report by the Archbishop's Commission on Reimagining Care, The report goes on to describe, at the heart of this report is a deeply Christian understanding of what it looks like to live together in community, with people caring for and supporting one another in relationships characterized by mutuality and interdependence. Right there, interdependence is recognized as a core behavior. The Commission seeks out to realize a new vision for care and support through three big ideas: rethinking attitudes to care and support, rebalancing roles and responsibilities, and redesigning the social care system. The report sets out to reorientate our priorities and direction for social care, drawing on our love for one another and being able to allow people to flourish, terms which rarely have been used in policy before. This conference uses the backdrop of recent government policies from across the UK that celebrates commitment to the transition to digital as a driver and personalisation as a focus. People at the Heart of Care of December 21 from UK government, making at least £1 billion available and investing £5.4 billion directly into adult social care. A Healthier Wales, our plan for health and social care of October 21 from Welsh Government, supported by £100 million investment through a transformation fund, and enabling, connecting and empowering care in the digital age of October 21 from the Scottish Government, with £224.6 million being available. That's over £6.7 billion being spent between the three nations. The nation's call for health, care and housing to be seen as one, because one can't work without the other. And it is this clear message of the role of housing and communities that lays the foundation of its importance. But first, allow me to ask you, what does home mean to you? Is it the security of having a roof over your head? A sanctuary to escape to after a long day at work? Or the assurance of a home being a place to watch your family grow up in? A reality for many disabled people is that just to get a roof over your head isn't a decision we can make on our own. I don't think people working in the system understand how complex navigating the system is just to get a place to call your own when there is such a shortage of suitable housing and the system being under-resourced. We should think about homes as more than bricks and mortar. Having an accessible, digitally wired home is important, but we need to see homes as places for connection. Housing should support inclusion, not seclusion, and integration, not segregation. What unifies the three nations is their approach, and from studying the policies, I have pulled some highlights. A willingness to overcome digital inequality and exclusion, experienced whether as citizens, professionals, or as a system. A commitment to digitise records of people who use services, and an acknowledgement of how the new data opportunities that an enabled approach to using tech in social care can offer. It's incredible that over £6.7 billion is being invested, but money is a system of value that facilitates the exchange of goods in an economy. What transforms investment into government reform, system transformation, and service delivery is an acknowledgement that in this fast-paced world, we need to stay ahead of the curve. But how do statutory agencies know exactly what is needed? That's where co-production comes in. Co-production is the process of nurturing the relationships with its beneficiaries and those who have lived experience, to invite people to be equal partners from grassroots to strategic ways of giving views, co-creating and influencing. Very simply, involving people. When you think of it, how can anything be personalised if people who don't use the service or product make sole decisions on the design? Yet we still have some way to go before the journey of involving people as equal partners, from the point of initiation to execution, is the norm. And for any co-production that doesn't follow that journey, then it's tokenistic consultation. Additionally, we need to recognise the impact being involved in co-production may have on someone's growth and self-development. It can build confidence through the validation of one's story and opportunity of being able to share it. Support you to identify your strengths as a person. Provide opportunities to pursue areas of interest such as leadership. Gives opportunity to contribute to creating a legacy and achieve something that you couldn't do on your own. And it gives opportunity to stand before 1,000 people at an international conference. In relation to tech, the adoption of co-production is essential when you consider care technology, whether that's new digitally enabled social care services, innovative software, or smart home systems. Luckily for us, the tech sector recognises the importance of co-production, of which you'll hear more about throughout the conference. And I just want to share some examples of what's happening already. Co-production features as one of 10 foundational principles of the Tech for Our Ageing Population Panel for Innovation, TAPI programme, which is led by Housing Learning and Improvement Network, Housing Lin, TSA, and funded by the Dunhill Medical Trust. TAPI is a benchmark for what good looks like in technology for housing and care. It puts older residents in the driving seat, and residents' experiences will show how tech-enabled care and housing solutions can better support people in later life. Another example is the creation of the Tech Action Alliance, who TSA are partnering with Think Local Act Personal on. This alliance aims to put centre stage the voice of people who draw on care and technology-enabled systems and solutions who are genuinely co-produced and person-centred. You'll hear more from them throughout the conference. My top tip to co-producing well is being aware of what it takes to do co-production well. What lies behind the engagement is the adoption of co-production being understood and embedded in the culture, co-design strategy, a budget for remuneration, and acceptance that it needs to be led by the process rather than deadlines. If these aspects are considered with equal importance, then you'll soon be reaping the rewards. And finally, in this year's conference, you will have noted questions have been asked of what does good personalisation actually look like when it comes to tech services. Which digital technologies should you use to implement personalised care? And how can we integrate these within mainstream health, care and housing? I hope, along with your experiences over these next 2 days, I've begun to provide some food for thought. Thanks for listening.
Well done. Thank you, Rich. I'm sure you will all be inspired by Rich. From meeting him, he's aligned government policy, he's driving our change in some of our programmes that you're going to hear over conference for the next 2 days. But he is a real champion that will drive our sector and give us the insights of what good really does look like for people in communities. So thank you, Rich. He's going to be around for the whole 2 days. I'm now delighted to welcome Paul Burstow, TSA Chair, and our Conference Chair for today. For those who are coming to conference for the first time, Paul has extensive first-hand knowledge of the care sector, has positioned himself really well to influence and support us, TSA, and the sector. As independent chair of Hertfordshire and West Essex Integrated Care Boards, he is at the heart of working in communities with partners to make this a reality. So for today's chair, welcome, Paul Burstow.
Good morning, everyone. Lovely to see you all here today. And I'll be saying a few more words later on. But at the moment, my role is principally to introduce our next speaker. Really, this is building on the first contribution we had from Michelle Dyson, setting out the English government's policies around technology-enabled care and social care. And now I'm really delighted to be able to invite Mike Emery, the Chief Digital and Innovation Officer for NHS Wales and the Welsh Government, to come up and set out the approach that's being taken in Wales. Mike.
All right, just trying to get my slides up and running. We'll get there in a minute. Brilliant. Bore da, good morning. I can't see your faces, but I'm hoping you're going to listen intently as I whiz through this. So many of you are probably wondering, who is this fresh-faced youth before you? And more importantly, who is this Englishman speaking on behalf of Wales? For those I haven't met, I'm Mike Emery. I'm the Chief Digital and Innovation Officer for Wales for Health and Care. I actually only landed in January in Wales in the system, but I have over 25 years experience of working in public services, and more recently actually in the English system as a CIO in an integrated care system. Perhaps later on, I'm happy to share some of my reflections on the difference between the English and Welsh policy environment and some of the nuances, but it has been very instructive all round. There are many similarities, but some important differences for me to talk about. So Wales, just a bit of background, more broadly. If we just flip on to give you an indication of the system. We have 7 health boards, 22 local authorities, over 400 GP practices. I think importantly though, the difference from England is those health boards are very much integrated health and care boards, though there is a nuance that we have 22 local authorities, so there is still that dynamic to work through. But we have been on that journey of integrated care for the last 10 to 12 years. So when people talk about these newfangled things of integrated care systems, I'm quick to point out there are some nations in the UK that have been doing this for a while. But we have some challenges, just like England. There are huge workforce pressures with regards to supporting the care sector, operational pressures on the front door, and an increasingly ageing population. All things that we have to think through how we can tackle in a different way going forward. In fact, actually, the Nuffield report in 2020 noted that the population in Wales was older, sicker and more deprived than England. And actually, the NHS has to work even harder. So a challenge for us all. So it is in this context that our Minister and many of the leading policy officials with health boards have been thinking very clearly about how we deliver care in the future. We see tech-enabled care as one of the biggest opportunities to respond to some of the challenges we face. You know, we believe we can deliver health services in remote areas who live, say, an hour or more in rural or remote areas more readily and in a more accessible way. This is going to be really important for people with chronic conditions who require ongoing care. We also believe that improved patient outcomes, as we've already talked about this morning, by improving access to remote care. Sorry, the slides flicked there and it confused me this way. By providing patients with access to remote monitoring and virtual care in particular areas to look after the development of their health problems and lead to better health outcomes, but importantly, reduce hospitalisations. I think for us, when we're looking at our health system, what has really encouraged me when I've arrived in Wales, though, is a real focus on the whole pathway of care and not solely on the pressures on the front door. And I think that, to me, is an essential element when we're talking about our policy around tech-enabled care. You will see here that our Minister, Eluned Morgan, is a huge supporter and is driving this agenda in Wales. And that is both a blessing and a curse for me as a policy lead, where we regularly talk about what we can deliver at pace, which is very encouraging, but also something for me to sometimes talk through with her around making sure we do this in a sustainable and an appropriate way going forward. But it is an exciting time to be in Wales. So where are we in Wales at the moment? Well, we recently commissioned a report by our national programme coordinating function, an organisation called ITEC Conference, who are here over the next couple of days to understand where we are in Wales around tech-enabled care. And you can see some of the figures and some of the background on the slide here. But we also reached out to many of you in the sector to understand what more we needed to do with you. And we recognise there is a need for greater engagement with you as providers to talk through what some of our problems are and describe them to you, and for you to help us to think through and solve with us some of those problems and challenges we face. We also need to work through with health boards and local authorities how they transfer into the world of digital. We're still quite analogue in many of our telecare and telehealth approaches more broadly across Wales. And this involves also thinking through a common approach and greater standards to the framework in which we work within the country. So we are working through at a policy level what that will entail. And we also want to promote and support the development of tech-enabled care. I think at times, and some of the feedback we've got, is there is a lack of understanding of what tech-enabled care can actually give us in responding to some of the challenges we face across the country. So all things we're working towards currently. In Wales, we have 11 alarm receiving centres, which are very much reactive. The things that we have worked on for several years over the last couple of decades around that reactive response to someone falling and sending an appropriate team out. But what's more exciting is some of the work we've been doing around that more wraparound responsive service. And over the next couple of days, you will probably become a little bit sick and tired of us talking about the work in West Wales. I make no apology about that, and nor will the team. We are very excited around the culture, the value and the model they have developed in Wales, and it is on that which we're developing much of our thinking and a blueprint for how we can scale out in the future. We've also got one or two other nascent programmes in as well as the dark blue, the lighter green there, in the south of Wales and up in the north, which we will also be building some of our thinking around. So just briefly, Delta Connect, as you'll hear about, is a programme that was funded by Welsh Government in 2018-2019. It very much supports our ambition around a digital-first care service, around transformation and integration of health and social care. It is a proactive, person-centred, asset-based, and I think that's really important. This is not just about a health-led service, this is very much a multi-agency approach, really close working between social care, community services, community sector and health bodies, and tech underpins and enables its delivery. Wrapped in that service model is a home-first service, we've got community response teams, and a wider telehealth developments. During the conference, the team will talk about how we're taking that forward from using technology from the 2010s to moving into the 2020s and even the 2030s to develop a more proactive model. And it truly is exciting times around developing something that is person-led. What has been really powerful around that programme of work is the fact that you've got leaders at all levels aligned but with the same value set, which is about delivering person-centred, proactive care. And it's really refreshing when you meet them. When I first came to Wales, there I was thinking, Wales, and forgive me, Welsh colleagues, there's that backwater, I will come and tell them how to do things. I came across this absolute gem, and it put me right to say there's some really good stuff going on across the country. But we have our challenges, which we've already alluded to in a few areas. So, for example, some of our infrastructure is probably not fit to deliver tech-enabled care across many of our rural areas and deprived areas. We will need to work with some of the big telecoms providers to see how we can improve that infrastructure, but also look at other options like low Earth orbit satellites to support some of that infrastructure, which we will be doing at the national policy level. There's a lot around the regulatory and policy framework, and this includes developing some common standards. We had a very good conversation last night with colleagues from the TSA around what we needed at that national level to set that framework. It is very evident to me that trying to do a one-size-fits-all approach doesn't work, but what you do need is frameworks and standards that ensures that everybody's working to a degree to the same brief, that allows you to share information across different jurisdictions, and because patients and people move across those different jurisdictions. And that is what we're working towards, because there are different starting points from different health economies, different social care jurisdictions that we need to be aware of. And finally, there is the challenge about patient acceptance and engagement. But I think, that's become more and more of a misnomer. Yes, we talk about digital inequalities, but we saw lots of people, digital literacy, growing during the last 2 or 3 years. So how can we work with them to use that digital literacy to support this agenda? It's not to say that this is a binary choice between tech-enabled care and meeting people face-to-face. This is part of the model. It's not an alternative. And that's what's been really encouraging around West Wales, the model they've developed. It is around technology enabling that model of care across the system. So, just to emphasise that success, I strongly believe, is reliant on us developing a good service model. This is just an illustrative example. In Wales, we've still got to do the work around stating clearly what is our policy around the model we want to develop for systems. And then, once we've set, if you like, that problem statement, we're working through what is the tech that we want to develop. And then we're working through how can we take the blueprint from someone like Delta and start to think what are the key enablers we need to put in place to scale that outwards. That includes, for example, setting, as I said, a standards framework, but also growing some of those response centres and their footprint. We've got 10 local authority areas covered currently, but we need to increase that. We need that more proactive approach to Care services, and we really do need to mainstream tech-enabled care and actually get some of the policymakers, some of the leaders, but also the population to understand what the information is we need to put in place. But that also includes thinking through collecting the data and joining up data more broadly. And that is also something which we're working together closely at a policy level, and something Michelle mentioned earlier on, and is a challenge for us in Wales, and that's probably the one area that we really do need to be focusing on in the coming months. So what have we learnt over the last 2 or 3 years? Well, this is more learning people have shared with me. Obviously, in the last 2 to 3 months, I've had to listen to people. But this is also some of my experience from my time in England. I've said leadership from the top. I actually mean, on reflection, and it was after a few more conversations last night, it's leadership at all levels. And if it's leadership that has a common value set around personalisation, you do row in the same direction. You're focused on the individual, you're focused on the person, and that makes a huge difference. As I said, though, leadership at the top, we've also got that passion from our minister and our policymakers, which is helping us take this forward. I think you must focus on the integrated service design model. The technology will follow what is the problem we're trying to solve. I do think, and I mentioned data, you need that data to ensure that as you move along, you're constantly evaluating what you're trying to deliver, and that allows you to adapt and change things as you go along, but also to help you identify those vulnerable, frail cohorts of people that you can deliver this service to. Collaboration is a word that's already come up this morning. You can't do this without collaboration, but it also means having some of those difficult conversations. Sometimes you just need to get to the bottom of why people don't trust one another, create those mature environments. That is difficult sometimes. And we need to be talking to you and you talking to us in developing, a good relationship and at times a long-term relationship to establish some of those common standards all round. However, there is one North Star that everybody mustn't forget, and it will come out time and time again. West Wales and the other successful places that I've seen in England don't lose sight of the person. I always use my daughter Emma as an example. Emma has learning disabilities, she's got epilepsy, and there were times in the night she'd get up and have the fit. So great, we ended up putting some sensors in that signified to us when she'd get up and possibly have the fit. That was great from a reactive point of view. However, now she's taken her watch and she's taken other devices and she uses that to measure her own health when she might be feeling tired. She looks at it also about the number of steps she does to keep fit. She loves it, and it's her looking after her own health. And that watch also allows her to go out and about, and I can track her now, which sounds a bit Big Brother, but it's given her the independence and me the confidence she's okay on her own. And then the other example I always think of is the elderly aunt of a friend of mine who talks about the fact, yes, she's got the reassurance of the falling monitor to react to, but she also talks about her friend, her woman in the box that opens her curtains, reminds her of her meds, reminds her when to take a drink, and even talks to her. I mean, that is Alexa, but it's allowed my friend to feel confident that she can live more independently at home for longer. So those are the stories that I think, we talk about the big macro policy things we need to put in place around standards and frameworks, but always we need to hold on to those North Stars of why we're doing this, which is about personalised, proactive care. Thank you.
Great. Thank you very much indeed, Mike, and also thank you to Michelle for her presentation. So we're now going to just wind up this session and open this session with a few remarks and move on to the rest of the conference. So I think we're going to move on to the first of my slides, which hopefully will appear on the screen any moment. So I can see... there we go. Very good. Very good. Good. Okay. Welcome to this conference. Welcome to what I hope you'll find to be an inspiring 2 days, an opportunity to network, an opportunity to catch up with old friends, and also to make some new friendships and share some new learning about how we collectively can take control of our future and really make sure that we are able to deliver better outcomes for our fellow citizens, the quality of life, the life that people want to lead for themselves. And I think what we've seen already, even in the 2 sets of speeches we've had today, and indeed the contribution from Rich, is just how much the ingredients of the future are already in existence. When we come to talk about Delta Care, for example, but there are many others around the whole of the UK. But the problem is at the moment that the future is not very well distributed across our country. It's certainly not evenly distributed. So what I want to do over the next few minutes is just say some of the things that I think are really going to be important to this conference. And also, as Alison has mentioned, I'm going to launch a new piece of work that the Tech Action Alliance has been working on over the last few months. Now, you've seen this slide already, but I'm going to put it back up again now. And this is a message which I and Alison and others at the TSA have been banging the drum for a long time now, but it bears repetition. And that is that we shouldn't be dazzled by the shiny kit. The kit is the enabler, and it's really that service model that we have to focus on, as Mike was talking about. That's where we really get the value add of the technologies that are increasingly available and how we get the value add of that switch from analog to digital. So that is really a key message of the TSA. It's a key message of the conference this week. And I just want to underscore something that Rich said in his remarks, which I think is really important, that is not about seeing technology or new service models being about not having people at the heart of them. Quite the opposite. It's about putting the person, their family, their social networks, the assets they have available to them to be able to live the lives they want to lead, absolutely at the heart. And the way in which we use our workforces may change, but that workforce, that relationship-based care will still continue to be absolutely critical. We've already heard it a bit in the remarks that have been made so far today, but we are, whether we want to use the word crisis or some other word, we are in a crisis when it comes to our health and social care system, whether we are in Scotland, England, Wales, Northern Ireland. It is an ever-present part of the dialogue. Turn on the news pretty much every day, and there will be some aspect of that crisis covered, albeit it will be reporting on the symptoms of that crisis rather than the causes of that crisis. And this chart just simply puts out some of the things that really are at the heart of that, whether it be increasing demand, whether it be the fact that our population often is experiencing poorer health now than it might have done a decade ago, whether it's to do with the workforce shortages, which we hear a lot about in the National Health Service, but which are even more chronic in social care, or whether it's about the adequacy of the resources or where the resources are being spent that is critical, or the nature of the estate that we currently deliver many of our services in. And the fact that all too often people are not getting access to the right care at the right time and in the right place. And that hospitals often are the worst place for people to end up. So being conveyed to a hospital with the likelihood of deconditioning and a lengthy period of recovery, and maybe not fully recovering, is really at the heart of that. And the UK is still not age ready. just the most recent data, just worth just sharing this, that progress on life expectancy in the UK has stalled. Over the last decade, we have not seen the significant increases in life expectancy that we had enjoyed over the last 50, 60, 70, 80 years. And indeed, if we rank ourselves in terms of the global league tables, the UK has slipped dramatically over the last couple of decades in terms of our life expectancy. And it's not just life expectancy gains that we are losing, we're going backwards in some regards. And the reality now is that we are seeing people living longer, a longer portion of their later lives with disability or disease, often multiple diseases. And that, again, is at the heart of the demand pressures that we have in our system. And without change, that widening gap between supply and demand is going to grow and grow and grow. And we can't afford, policymakers, practitioners, service deliverers can't afford to have their heads in the sand when it comes to the demographic pressures that exist in our country, both now, today, and over the next 20 years. At the event that Mike mentioned just now, we were talking a bit about those demographic pressures and the fact that over the next 20 years, the boomers move from caring for their own parents to be the people that are being cared for by their children, and also increasingly in need of a rich and diverse range of health and social care services. The frailty, the multimorbidity that they will represent requires us to make the shifts that we've heard some talk about today in the speeches we've heard from Michelle and from Mike. And just to rehearse it, we need to get beyond the words to the will and how do we deliver this. And I think it was good to hear from Mike some of the practical steps that they are proposing to take in Wales and some of the practical steps that are being proposed and are being taken in England. But the reality is that the ambition isn't great enough. The will is not strong enough everywhere to make the progress we really need to see now. And yes, the digital care record that Michelle was talking about is absolutely key, a piece of infrastructure that we can build much of the other change upon, or the importance of the examples like Delta Care that Mike was giving, and that need for a framework and standards being absolutely critical. And yes, we do need those North Stars focusing on the individual. But when we come to what it requires next, that's where the Tech Action Alliance that we announced last year at this conference, which is a coalition of those that are both willing and interested in seeing the role that technology can play in enabling richer lives, we have been over the last year working together to formulate the first steps in a plan to mobilize, I think, everyone who is interested in making technology a key component of the models of care of the future. So I'm really pleased that we are launching today this report, which you can see up on the screen, and I will now, because it's a tokenistic thing you should do at these points, wave this document in front of you and say, please do have a look at it, because this is our challenge document. This is a document that sets out the things that we think governments at every level, providers of services at every level, suppliers of equipment at every level should be taking on board, and it contains a whole host of vital information and evidence of the difference that technology can make. But it sets out in the report, in particular, 8 key recommendations, which I'm not going to rehearse in great detail now, and they are resonant with some of the themes that we heard from Michelle and from Mike already today. But they are about fundamentally how we center the transformation of our services around the lives of individuals, how we draw on their assets, but how we make the most of the data that we have to really gain insight, to act in a different way, not reacting to events, but actually anticipating them and providing a very different model of care as a result of that. And that, again, is why we need to make a shift that we were talking about at the TSA event last night, but which is going to infuse and inform a lot of our work going forward. And that's a shift, if you like, to a home-first approach that really does make technology a key component in making that work in practice, but which is about engagement, about reducing isolation, about providing information, about making sure that people are confident, have that peace of mind that things are being looked out for. So that coordination of activities, really centering that around families and communities. is a key part of that. And as we heard, I think, really powerfully from Rich, just how important the home is as a place of connection and inclusion and integration, and how we can use technology and all of that to actually really make a difference for frontline workers as well. And a phrase that really, I think, if you're an occupational therapist, you would recognize is that all too often we spend our time having conversations with people about what is a matter with them, when in fact we should spend far more time having conversations and listening to people about what matters to them. Because through what matters to them, we can design services and responses that really do fit their needs and circumstances. And the report that we're publishing today, it sets out a whole set of exemplars from across the United Kingdom that we think are really powerful examples of what the future can look like if only it was brought together in a coherent way. And at the heart of that are a number of changes that we think are absolutely key. You've heard the word co-production described already today, and I won't define it further than the brilliant definition we had from Rich already. But that need to focus it around driving change by focusing on people, or actually describing some of the key features of a proactive service, of setting out the new model of care, and we're saying more about that at our conference over the next 2 days, and identifying those barriers that get in the way of genuinely personalizing our services. And yes, making sure that we continuously evaluate and learn and make sure we focus on articulating what the benefits are for the individual and for the system. And then making some recommendations in this report as we go forward with the work program that this report kicks off, of really making sure that we have the policy environment, the regulatory environment, and the funding environment aligned to deliver the changes that we need to make. Because if we don't, we'll be stuck with this, doing the same thing and hoping that somehow this time it'll deliver something different. And that is the real risk. And that's why the TSA is absolutely determined to make sure that we do start to do something different so that we do actually start to get different results. And that is a challenge for those who supply services in this sector today and supply equipment in this sector today. And it has to be, I think, a question and theme of this conference: how do we collectively make the change we want to see happen, and not just sit where we are today, hoping that our market will continue as it is today. And that does mean that we have to make a really big switch, and we have to move to being providers of solutions and partners with those who are commissioning our services. And we've seen that already. We saw it during the pandemic. During the pandemic, we saw a pivot within the NHS to virtual ways of delivering healthcare services at pace. It can be done. We can change quickly when necessity drives us. Well, the necessity of the burning platform that is burning all around us now should be a sufficient imperative to actually make us move very much more quickly than we are at the moment. Last couple of things I want to say. In launching this publication today, I just want to thank all of the organisations that have come together to form this alliance, this coalition of the willing and those interested in making technology part of the answer for our future. Really grateful for all of your support and your continuing support. Heard a little bit about system working and integration, and how different countries in the United Kingdom have got to this conclusion at different paces over the last few years. But certainly in England, the ambition now of integrated care systems, I think, is real and palpable, and we have to make it work. But this chart very simply puts up the idea that what we are fundamentally trying to do is make a shift from a framework which was fundamentally about institutions and the services that they might provide to the citizen, to working around the needs of the population and the individual, of making that shift from a system that was highly fragmented and highly orientated towards secondary care to a system that increasingly is about moving left, not politically, but practically, towards greater prevention, self-care, and social care, so that we actually are putting the resources in the right place to deliver the right care at the right time. And my last slide really is just to make a plea, I think. We all have a part to play in raising awareness. And just today, there's been a report published by the King's Fund and the Nuffield Trust. They were looking at the data from the British Social Attitudes Survey, and they found that 57% of the general public, right across the board, politically, age-wise, and so on, are dissatisfied with social care. It's 57%. That's a marked increase over the last 3 years. And when you then exclude the people who have not any direct or indirect family experience of social care, the remaining group, 77% of them are dissatisfied with social care. The people who have day-to-day experience. That is a burning platform for change in social care, which I hope ministers and I hope policy officials are listening to and will want to respond to. And a phrase that stays with me from the conversation we were having last night is that there is an epidemic of family distress going on in our country today. That's represented by that 77% of people who are dissatisfied. We as a sector have an opportunity to play a part in addressing that epidemic of family distress, because people want peace of mind. They want the comfort and the knowledge that their loved ones are safe and able to live the lives that they want to live, and that they can be both independent and interdependent as well. So, in closing, I hope you enjoy this conference. I hope you will be stimulated and inspired by this conference. I hope you find the exhibition to your liking and that you will learn and network there as well. But above all, I hope when you go from this conference, after being here for 1 day or for 2 days, you will go and play your part in mobilizing the case for change and not just being there as part of maintaining a status quo that is broken and well beyond its sell-by date. Because if we don't do that, we will not make the progress this sector should be making to make a difference for the lives of people in this country. Thank you all very much for your time this morning. Now we're going to break and go into our conference sessions. Thank you very much.